Have you ever struggled to find an appointment with a doctor, or maybe you forgot to follow up with your appointment? What if we could look at the future where there are no diseases, and maybe most of the diseases like cancer, diabetes, mental health illnesses are no more existent? If you want to know the answer to this question, just watch the video till the end. Hello ladies and gentlemen, I am Dr. Anilraj Chetri and I am an assistant professor here at Inspira Knowledge Campus. Today I am going to talk about the emergence of AI in the healthcare industry. Let's understand what is AI. AI is an all-inclusive term used to describe machine learning, algorithm or software to mimic the human cognition in the analysis, presentation and comprehension of complex medical and healthcare data. So basically we have the algorithms to solve the most complex medical data or the problems at your fingertips. Let us dig deeper and see how is AI transforming the healthcare industry. There are many scenarios where AI is turning to be a game changer completely. Let us look into a few of those examples. To begin with, let's talk about our hospital sector. In the hospital industry, AI is used in various areas. In the medical record department, to retrieve information from the medical records, to do something simple as appointment scheduling and follow-up. When you are in the starting of the video, I talked to you about an appointment. Yes, now Google has developed an AI assistant called Duplex that can actually call and book an appointment for you in real time. How amazing it is, right? It can instruct even nurses in the hospital AI for certain specific procedures. Because of all these factors, the amount of workload on the doctor decreases, and because of which we have a better clinical efficiency in the hospital. Now let's look at how AI is used in the radiology department. It is used to automate image analysis and outcome. So sounds complex. What does it mean? It means that it is improving the physician efficiency and reducing the human error here. So it can open a doorway for improved tumor detection in CT and MRI scan. So basically we could detect cancer at a very nascent stage, and so by saving the life of many people in the long run. Now let's talk about the biggest health industry. Do you know what it is? Yes, you guessed it right. It's the pharmaceutical industry. Since the onslaught of COVID-19, researchers around the globe have been working day and night to find the vaccine for the pandemic, because that's the only defense for humankind against such an epidemic. Wouldn't we have wished that we had an AI solution that could scan the vast database of information on the existing medicine and basically help us to find the cure by finding newer drugs at a faster rate, so that next time when we face any kind of such threats, we are already ready with a solution. Now let's talk about an AI being used in another important factor in the healthcare industry. Yes, it's for the screening of disease. As a lot of industries are taking a leap towards a data-centric approach, healthcare industry is not very far behind. By analyzing a lot of patient data, we have come across solutions. By studying about a lot of historical patient data, AI softwares can now determine solutions that can predict a lot of diseases that we are going to have in the future. For example, AI can be used to identify the readmission risks. Now what is readmission risk? If the patient is hospitalized and after his discharge, if he gets readmitted due to any kind of sickness in the body, it is called as readmission. So an AI software can actually identify the readmission risks in the hospital patients. Using certain facial cues, the AI can even detect people who have a tendency of developing mental health illnesses in the long run. Can you believe, just by looking at your eye screening and still images, we can predict a lot of eye diseases? And not even that, we can also predict the cardiovascular diseases in the future. Right now, our healthcare system is overstretched, and government has been stressing a lot on primary healthcare sector. Do you believe that you could use the AI technology in the primary healthcare sector? Yes, the answer is yes. A lot of industries are now using the voice chat based system. Yes, there could be a health chat bot that could easily talk to you and identify minor health problems and even suggest solutions to you. Yes, because of this, we could reduce the number of visits to a general practitioners in a year, and also this will answer the question of accessibility of healthcare in the far from rural areas. So I think using an AI technology in a rural health sector, it's a boon for our medical community. Though the AI technology looks so promising, but there are a lot of challenges and hurdles on the way. The success of AI rests on receiving a vast amount of patient data so that we can train and optimize the performance of algorithms. But in a healthcare setting, getting an access to this patient healthcare data raises a lot of ethical questions that we need to answer. Some of them are like simple as patient confidentiality. Accessing someone's personal file is a confidential issue. Would you be comfortable when someone looks into your medical record? There is a gray area of liability that we are not talking here when it comes to AI. Developing regulations for a technology that is cloud-based and constantly in the process of evolving through learning itself poses a lot of challenges. It generates the obvious question: will the AI company take the liability if anything wrong goes in the diagnosis and the treatment of the patient? Another big scenario that we need to look because of the advancement of this type of technology is the lack of human touch. The human touch of interacting with the doctor can be lost with this kind of AI tools. The big question here, ladies and gentlemen, that we need to answer is, as a patient, are you willing to trust a diagnosis from a software-based algorithm rather than a human? As we meander through this difficult and challenging question, let us look at the future outlook for AI. In the next coming few years, the best possible chances for an AI technology is a system where the clinicians are supported in the diagnosis, treatment planning, and identifying the risk procedures using an AI technology. But the ultimate responsibility of the patient care still rests with the doctors. This is nothing but we are talking about the hybrid models that can exist in the future. Basically, this means we are creating a win-win situation for both the AI and the healthcare, and this will lead to an augmented healthcare delivery system in the future. Now we come to the end of the topic. There is a lot of unknown, and there's a lot of research to be conducted in the field of AI. But yes, the AI definitely shows a lot of promise for us in the future, where it can be used to solve complicated health problems and diagnose health issues before they even arise. This is just the beginning indeed. And as it has been rightly pointed out by Steve Jobs, innovation is the ability to see the change as an opportunity and not a threat. Thank you, friends. I hope you liked the video, and if you really learned something interesting out of it, kindly like and subscribe to the channel, and if you have any kind of queries, put it in your comment section below. We would like to hear from you. So this is your host, Dr. Anil Raj Chhetri, signing off. Thank you.